Welcome to Deuk Spine Institute. I'm Dr. Deuk Majan. Our patient is here with neck pain. He has facet joint pain, which is pain involving the facet joints in the back of his neck. Second most common cause of neck pain after a disc problem. He injured his neck at work, and he's here for treatment, definitive treatment to the facet joints. We call this treatment the Deuk plasma rhizotomy. The goal here is to eliminate pain coming from these facet joints. Now, Henry, let's show the audience how facet joints can cause pain while I get started.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. I'm Dr. Deuk Majan, CEO and founder, and the surgery you're watching is called the Deuk plasma rhizotomy. The patient has an extremely thick neck like a football player, and he's been having this pain at the base of his neck. It even causes muscle spasms, which shoot up his neck, worse on the left side. And the pain is coming from what is called the facet joints. He's injured those facet joints in a work-related injury. Shot. We've already treated the upper facets, the ones higher up, but he came back with more pain below where we treated. So we had to deal with the lower facets now, and that's what we're doing. The pain nerve to the facet joint runs around the waist of the lateral mass. And maybe, Monica, you can show the audience where the waist of the lateral mass is. Go ahead and put your pointer there. Are you here? Yeah. So just go to the side that I'm working on and go up just a smidgen right there. That's the waist right there. All right. So that's where the nerve wraps around, and then it goes and innervates the actual facet joints. Okay, above and below. So let's get a shot. We use the X-ray to guide the probe, and as you saw in the video, we use the probe to destroy the pain nerve. Shot. Yeah, that's right where the pain nerve is. It's perfect. Got that one. Feel good about it. Now we're going to move to the next one, further down. Shot. Very good. Any questions?
At this moment, no current questions.
So I will be honest and tell you this is the the thickest, deepest neck I've ever done surgery on of this type, Sean. Not an easy case by any means. Very difficult, but we're getting it done. He's been in a lot of pain, and I want to fix him. Sean? Alright, got to get down a little bit lower, and we'll be done on this side. Got to get down to the transverse process of T1, which is where I'm working now. Let's get a shot. Little bit further down, right there. Yep. That should take care of it. Get a shot. We use the X-ray to guide our treatment. You can see right where the tip is. That's where the pain nerve runs. So just making sure. We're done with the left side. I'm going to go to the right side. Any questions?
At this moment, no current questions.
All right. So we've just treated the facets on the patient's left. Now we're going to move to the right. And these are the C7-T2 facet shot. I'm going to go a little more lateral. Shot. Is he doing okay? All right. That's perfect right there, Luis. Help me out. Yep. Thank you. Very good. Any questions?
At this moment, no current questions.
So what's different about the Deuk plasma rhizotomy? It is a different procedure than radiofrequency ablation. Radiofrequency ablation is where the surgeon or doctor puts in a skinny little needle, same target as we're going to here, but lays the needle on there and just steps back and turns it on burn. And the burn is for at 80 degrees Celsius, right, Louise? For 90 seconds. Sorry, I was just thinking about the staples. Good, we're almost done. So when you do an RFA, you're just putting a needle down and burning. When you do a Deuk plasma rhizotomy, we're actually cutting the pain nerve. You have a mosquito. Not the insect mosquito. Thank you. Any questions?
At this moment, no current questions.
I would do a little pressure dressing.
Yes, sir.
All right, we're going to move on to the right side. We've completed the left. The blood loss for this surgery is quite minimal. The patient is asleep. We want him asleep. This is painful surgery, Sean. If he's awake, it's going to hurt quite badly. So we did have one patient choose to be awake. He was of the opinion that anesthesia was toxic and that the drugs given by the anesthesiologist would be toxic to his body, so he chose no anesthesia against my recommendation. And he actually did fine. There was a lot of yelling during the procedure, and I offered him, to stop and give him anesthesia, but he refused. Instead, he just said, "Keep going. Remember him?" No. It was traumatic for you, I'm sure. Dr. Brenda says, "No, I don't remember him." But I think you were here for that guy. Sure. Right? Shot? Yeah. But it was right in the beginning when you started. Shot? All right. So I am destroying the pain nerve right here.
We haven't seen that patient back, so I'm sure they're cured.
Oh no, they're cured. All the patients are cured. They're all cured. The procedures work. We got it done. It's just, it was a bit of a challenge. And I know the nurses didn't feel good about it. I didn't feel good about it, but he absolutely refused anesthesia. So what can you do? It's his right, his choice, his body. He has to decide. We warned him appropriately and offered to stop the procedure and give it to him, but he still refused. Anyway, we're just about done. Any questions?
At this moment, no current questions.
All right, we got about 20 seconds left. Thanks for joining us. The last surgery was a much bigger surgery, much longer. This one is a bit of a quicker surgery, but we're going to be done very, very soon. I just have to get down to T1 and take care of that pain nerve down there, which I'm doing right now. Any other questions, Shot?
At this moment, no current questions.
All right, well, Henry, thank you. We're finished, and we can go ahead and wrap up the stream. Oh, I'll show them the incision.
Of course.
Let's show them the incision. We're going to put a little medicine to reduce the inflammation. Let me show you the incision. It's tiny, folks. It's 4 millimeters. Right here. You guys see that?
Yes, we do.
It's literally just a stab incision. We did both sides because he has pain on both sides and Facet syndrome on both sides. Let's run the Facet pain, cervical Facet pain one more time, and then you can end the stream.
Copy that.